SRH is largely underserved. It's largely uninvested in, right? So, typically every protagonist or every operator within the space will be familiar with telemedicine, will be familiar with medical delivery, but SRH is underserved. Now, to actually help us unpack some of these nuances, we have three individuals who have been working within the space for quite some time. And already on the stage is my good friend, Shehu Steve Tawia. And some of you might already be familiar with him, but Steve right now pioneers one of the health tech focused investment funds in the continent, Jaza Rift. And I will allow him to introduce himself in a bit. We also have Anne. Anne runs a company called Imani Health, and she will also introduce what she does at Imani Health. And finally, Emmanuel. Emmanuel comes from an organization called Velcro, which incubates and supports healthcare startups as well in the continent. So
I'll tell you a funny thing. When I started, I used to do a lot of communication and marketing to women because it was a women's product. But men took it up a lot faster. Men took it up a lot more compared to women, which is a good thing.
The sexual and reproductive health space is one, especially in Kenya, is one area that is, it's somewhat taboo, right? And you have, so for example, someone will come up with a product that makes washable pads, for example. And it's like within the community, we are not supposed to be talking about pads. It's like something that is taboo. You don't need to talk about it. And what does that do? It essentially makes even the players in that space sort of shy away from innovating.
I think the first thing that needs to be done is define what SRH is. Because actually not many people know what it covers. And as you mentioned, there's a bit of it that is also a bit of stigma, right? So essentially, it's about providing people with the right to choose however they want to conduct their health, sexual health, right?
Fundraising is hard. Let's just be honest. Whichever way you look at it, fundraising is just hard because it's a chicken egg situation. When I come to Steve asks me, so what are your numbers? And I need numbers to be able to get to show Steve, and I need money to be able to get the numbers. So it's a chicken egg scenario. What comes first? The major assumption that was debunked, and I think it's the same assumption Steve made a few seconds ago, is it's a 600 million market. No, it's a 1.2 million market. Men are actually very, very involved in sexual and reproductive health, as has been proved by the statistics. Like most of the people who actually save in their wallet are not women. A huge number is men. On a scale of 1 to 10, like 6 is men.
How come we don't have in any public school access to PAD? Anybody who's been up in a school that is above 13 years old, right? Need to have access and education around it, etc. And so I've seen a few models, companies that are doing so. But again, I know of that company because I dealt with that company in a engineering situation where I was coaching entrepreneurs in that space. And so again, to come back to my answer, really it's about looking for it and doing a call in that space to really figure out, okay, what are the business models, who is doing what in this space is a good idea, number one. Number two, I also think that from an investor's perspective, it's very often perceived as a public health theme.
If you never ask, the answer will always be no. It's just coming to Steve and coming to Emmanuel and saying that this is a concept I have and this is what I see it being able to do. And sometimes it doesn't even need money. It just needs someone to be able to just knock on their door and say, this is my concept, and someone will hear you out.
So I think there needs to be an element of being intentional, because if, for example, we call ourselves a non-profit venture capital, if I shy away from supporting or approaching research or young businesses that someone at Steve's level would probably see as a risk, then I'm leaving a certain gap that needs to be bridged, right? And so I need to be intentional in approaching academia, approaching government, and asking, like she said, right? Communicating what I'm trying to do, trying to see how I can bring on board, whether it's county governments, whether it's national governments, to bring them on board and help them adopt some of these solutions, or at the very least, know that it exists, right? Yeah.
How can we say, look, you team of 2-3 people, we give you money, go and do the research, design a product or a service, and then we fund you. And once you get traction, then we can support you. And me, I'm a very big proponent of a model that we coined B2G, business to government, but the other one is business to donors. So you can go and reach out to the WHOs, the UNICEF, etc., donors that you can work this idea with and then convert that to B2B, to C or B2B, but it's a kind of a transitional, and then you still have your donors or your government that is your customer, but you know they don't always pay, right? So these are the two models. And I think there's a huge opportunity on that because we've been saying we need to set up a Femtech Labs as part of the Venture Studio where we look at all these innovations that we can create and the existing ones to get that to the next level. So if there's any person interested here, they should reach out.
The HANGA SRH program is a program by the Rwandan government with the Ministry of ICT, the Rwandan Development Bank, essentially to find and back about 20 startups that are solving for various issues within the field of SRH. And I'm saying various because they could be many and anything. As our good friend Steve here said, it really depends on the angle that you're looking at it. So this could range from femtech products to solutions that are solving for gender-based violence, to solutions that are solving for child mortality, maternal health, contraception, and so on and so forth. Right? We're looking for these solutions essentially, and not limited to this. And one of them that I also want to mention is solutions that target young people with youth-friendly SRH information services, right? So, solutions that help spread knowledge, and pure facts, debunk myths about sexual and reproductive health, and, omit stigma in the community are welcome as well. So what's up for offer? About $10,000 to $30,000. I mean, hey, we know that it won't change the world, right? But that's what's on offer, and a 3 months long curriculum training program. So taking you through basics on intermediates of how to build your business essentially. Then about 9 months of tailored venture building support. We do understand that not all ventures are at the same stage. The needs are also different. So that's why that's also on offer here. So yeah, I mean, the deadline is pretty soon. You have about like a couple of weeks to send in your application. So yeah, I mean, I think mambo ni mawili, right? So if it's either, they're just, no, there are two, there are not three. If you run such a company, please apply. If you know someone who's building such solutions, just pass the word around, okay? I mean, I think with that note, then I would actually, this is the link. Feel free to scan the QR code, and that takes you directly to the website.